So we're currently facing a non-communicable disease crisis, not just here in St. Kitts and Nevis, but in the region. Contributing to the development of non-communicable diseases are the modifiable risk factors of an unhealthy diet, physical inactivity, tobacco use, and alcohol consumption. To combat NCDs, we have to change our lifestyle and adopt healthy behaviors. And this, to me, requires a lot of introspection, especially around the way that we spend our leisure time. So when we think about the Carnival season, it's an important historical, cultural, educational, and social activity that facilitates community cohesion, promotes the local economy, and boosts tourism. Many aspects of Carnival are very good for our society, but we do have to recognize that there are excesses of Carnival, particularly around unhealthy behaviors, which are not so positive, particularly for our health. So the overconsumption of alcohol and other unhealthy beverages have a negative impact on our individual, community, and environmental health and safety. Therefore, during this event, we aim to stimulate discussion on reimagining Carnival to create a healthy drinking culture. I know this may be a topic that people don't necessarily want to discuss, but we feel it's an important one. And we think that by creating a healthier Carnival, we can reduce the public's exposure to a key risk factor for NCDs. So we believe this is of the utmost importance because of the threat that NCDs pose to our lives and livelihoods. So without further ado, we're going to start the panel discussion, and we have a fantastic lineup of panelists, and I'm going to hand over to our moderator, Ms Patrice Harris, who is a corporate communications manager at SKELEC, and Ms Harris will come up, thank you so much, and introduce our panelists, and then we'll begin the panel discussion. So thank you so much.
Good morning, everyone, and thank you so much for joining us for the Lake Health and Wellbeing panel discussion, where the topic will focus on reimagining Carnival, creating a healthy drinking culture. The panelists for this morning's discussion will include Dr. Merisa Grant-Tate, medical oncologist at the Joseph N. France Hospital. Dr. Tate, welcome. Mrs. Karimu Byron-Caines, director of the St. Kitts-Nevis National Council on Drug Abuse Prevention. Mrs. Byron-Caines, welcome. Dr. Al Pierre of the St. Kitts and Nevis Medical and Dental Association. Dr. Pierre, welcome. And the Superintendent Cromwell Henry of the Royal St. Christopher and Nevis Police Force. Superintendent Henry, welcome. So we'll take our seats and the discussion will begin. So this conversation this morning will focus on creating a healthy drinking culture, and this is extremely crucial understanding what our realities are in St. Kitts and Nevis, primarily because the festive season includes Christmas and the Carnival. So first we're going to explore, I'll ask the panelists to jump in at this moment to help us to understand what is the drinking culture of St. Kitts and Nevis, especially around this time.
All right, good morning. It is indeed my pleasure to sit on this panel to discuss this very timely topic. I was very happy to accept the invitation because it is at this time of year when the traffic department usually increases its appeal to the public, the driving public in particular, to be responsible in their drinking, or preferably to avoid drinking and driving. Because we realize that at this time of the year, there is generally an increase in number of accidents, and most of these accidents, or the most serious of these accidents, are usually caused by persons who have been drinking. And so we take every opportunity that we can to appeal to drivers to curtail, avoid their drinking if they are driving, especially at this time of the year. So what is the drinking culture in St. Kitts? And what do I understand by drinking culture? For me, the drinking culture is those traditions, social behaviors, or the social policies that surround the consumption of alcohol. And the tradition includes events, customs, and beliefs that are long established and passed down to generations. Beliefs about drinking. I can recall reading
So the moderator
where
should
a
take
doctor,
it from there.
he was trying to explain to a patient who was an alcoholic the effects of alcohol on the liver. And to demonstrate this, he had a jar with some fat, healthy worms, and he poured a glass of alcohol, rum, on the worms in the glass. The worms, of course, they begin to shrivel, and they became smaller, and they eventually died. And he asked the patient, what did you learn from what I just showed you? What did you learn from this? And the patient's response was, rum is good for worms. And so that is what he took away from that demonstration. And there are people who think that way. They think that if they drink rum, the rum kills the worms, and so you won't have a worm problem. And there are a number of beliefs that people have surrounding alcohol, and this informs their behavior. We have also seen, and it is more increasingly so, that people celebrate with alcohol. They think that in order to celebrate, you must have alcohol. And so if there's a funeral, after the funeral, there's alcohol. If there's a graduation, some sort of celebratory activity, they would have alcohol. If you have domestic problems, you're disappointed, you're depressed, you drink alcohol. And so it almost appears if it's a custom to drink alcohol for any occasion. One businessman once told me that he's into the alcohol business because it is the one thing that people drink for everything, people use for everything. Celebrating, you drink. If you are depressed, unhappy, you drink. If you are mourning the death of your loved one, you drink. And so he's into that business because of the attraction of alcohol for almost any activity. And so this has become a part of our culture. We use alcohol for almost anything. And at this time of the year, when it is the biggest celebration in the country, that is the time people consume alcohol even more. And so we would want to change that culture to the extent that you do it more responsibly. Make it a healthy culture so that you could drink, you could enjoy yourself, but not in a way that causes more harm to you or to persons who you love or persons around you. And I think this discussion is timely so that we could begin to sensitize persons of the need to change the culture to the extent that we drink more responsibly and drink in a way that we remain healthy even after drinking.
All right, Superintendent Henry, that was quite a mouthful. Quite a mouthful, but we were able to have a better understanding as to what are some of the belief structures, especially in St. Kitts-Nevis, as to why we see the type of drinking culture that we have primarily around the Christmas and Carnival season. Is there any other panelists who would like to chime in at this moment to speak more about what exactly the drinking culture includes?
All right, I guess I'll go. A pleasant good morning to everyone. Before I chime in on that topic, I would like to commend Abby and her team at Health and Wellbeing for putting on this panel discussion and this event today. I welcome the initiative and I'm glad to be part of this discussion this morning. As it relates to the culture of drinking in St. Kitts and Nevis, Henry would have mentioned quite a mouthful indeed, but just to add to it too, something that we observe from statistics is that in 2013, we did a secondary school drug prevalence survey. And one of the questions we asked is the first age of use. And what we realized is that for alcohol, it's normally around the age of 11 or 12, 11, 9 months in St. Kitts and Nevis. And this jogged my thoughts to think of the fact that it's also a rite of passage when you're moving over into high school. It's about that time of age. A parent may say, okay, you're old enough now. You can have a little punchy Cuba or another small drink. So it's very much part of our socialization fabric in the Federation. As he rightfully said, at every event, alcohol is expected to be there. As a matter of fact, in speaking with some of my colleagues, they would have mentioned if they go out to different events, it is just expected that you will have alcohol or some sweetened beverage, at the event. Without it, you will seem someone as an outsider, as you're coming into this setting and not fully part of, because you're not having that alcohol. So it's very much accepted. There's a rite of passage factor that we have at an early age, and the idea of the harms associated with it, it's very low. So it's very norm, it's accepted, and pretty much part of our society. So that's why I welcome this discussion, so people can be educated and informed about how it really affects you and our society as a whole.
Having lived throughout the region, I think the culture of alcohol in St. Kitts is certainly not dissimilar to the trends we see in the rest of the region. In fact, in 2016, which is some time back now, there was a study done that showed that over 43% of individuals in Latin America and the Caribbean, 43% consumed well above the normal limits of alcohol, but the Caribbean was 50% higher than the rest of Latin America. So I think this is an important discussion, but I think there should be some historical context. The Caribbean traditionally has ties to the rum industry. That's where our sugar mass itself. And I think those historical ties to rum, I think is also an important one to make, to understand why we've grown into the culture where alcohol has become part of our social fabric. In fact, a foreign minister of I think it's Minister of Tourism again, would say to me, alcohol is the lubrication that facilitates social intercourse, right? In the sense that if you don't have a few drinks, and this is very, very common with men who gather on the bars and the rum shop, and if there aren't a few drinks going by, I mean, the conversation is just not stimulated. So there's a point at which, after a couple of drinks, suddenly everyone loosens up. You see the shoulders relax, and people become more vocal. People can speak this because all the inhibition is lost, right? So I think we have to look at this, and it's a much broader conversation that I don't think that we can totally discuss it, because there's so many other reasons why alcohol is such an important part of our socialization. There's mental health issues. There are issues in terms of what else do we do, right? I mean, if you look around and you have a family here, walk the strip, right? And then come off the strip and ask yourself, what else do I do with my family or my friends or visiting family here in St. Kitts? There really isn't much. There isn't a single place you go to where there isn't a well-stocked bar, because that seems to be the thing to do. It's also a measure of our ascending in terms of class, right? So you move up the shelf. So top shelf is a thing that actually is directly linked to your economic reality. So there are many reasons why this is so, and I think this is timely. It's a great first discussion to have. I don't know that we will discuss all the things that need to be done, but how we reframe that mindset around alcohol. And Abby said that's something I will speak about, and this is why I always jump on this opportunity, is because it requires an all-society approach. And I don't think it's about castigating anyone. I don't know anyone in this room in some form or fashion is not associated to perhaps going above their normal limit, or a partner or somebody, a loved one in your home who ever so often, but I think we need to establish what that limit is. I think that's where we fall short. What exactly is the limit? We don't have breathalyzer tests as we do in the US. We don't have laws around saying that you cannot serve alcohol after 2 a.m. I lived in New York, that's the thing. After 2 a.m. you cannot get, if you want to drink, you go home to drink, right? And also, you're also always hyper aware that if the police stops you on the way because you're just texting on your phone, the first thing someone would do is actually either have you walk a straight line or do a breathalyzer test. So without those measures in place, it's very hard for one to tell, what is that measure? Where do I stop? And I think that's what I hope we can speak about here in terms of not saying you shouldn't have any alcohol, but simply what is a safe level of alcohol where you can appreciate what our culture is, or a rum culture in the Caribbean, enjoy all of the festivities of the carnival, but also get home safe, get home alive, right? Arrive alive, right? And also as well to prevent the onset or delay the onset of all those metabolic and NCDs that we talked about. So I think that would be a good way to perhaps approach this conversation.
With understanding all of the realities associated with alcohol use in St. Kitts and Nevis, primarily around this time of year, and where we have already discussed it being so common, it being so linked to our social activities, how are we able to make that differentiation as to abuse of alcohol or just the regular use of alcohol? What then is when we go over that line from just a normal use as opposed to alcoholism and abuse of alcohol?
Good morning. So first of all, I would like to echo the sentiments of the rest of the panelists by congratulating Lake Health on what is a very well-organized session, and also obviously too quite timely. What I would say as it would relate to limits that we should observe in respect to alcohol, I think basically the issue is that what we look at access is when someone is now falling over, they're sloppy drunk and so forth. And obviously that is something that varies when it comes to content as it would relate to the individual. So that is the first problem that we have. If we're waiting to simply say that you would have had excess because of the fact that you're so drunk, falling all over the place, then that really isn't sufficient of a standard. Although we do not have the breath analyzing tests in St. Kitts and Nevis, so I am aware, having worked in the accident and emergency room for of 10 years, that we actually do have the traffic officers that would bring the patient or the individual who would have been involved in vehicular accidents where there may have been a suspicion of alcohol. And so then anything that is in excess of 2 grams per deciliter would be considered to be over the limit. And so then that is actually the standard that is used within St. Kitts and Nevis through what is a blood test. In terms of the content of alcohol that you get per drink, then obviously we have an issue, because the average drink has about 13 grams of alcohol, single drink. And in terms of the type of drink, if you're dealing with what would be the spirits and so forth, then perhaps as much as up to 20 plus grams. And so then you can see that you really don't even need to have what is a full drink to be well over what is the standard limit. And again, in terms of the how to view it, in terms of what content and so forth, when I would have been studying general medicine a very long time ago, it doesn't look so right. When I would have been studying general medicine quite some time ago, in psychology, we were often reminded of what is the general transition that an alcoholic goes through in terms of their life. So at the start of it, we would refer to what is the king status. In other words, this is when you're pulling up in the clubs, you're the social icon of, what is the environment, buying drinks for everyone, have girls on your hands and so forth. And at this point in time too, as it would relate to what is the tolerance, generally you have what is a much higher tolerance, and so then you're able to have beer after beer or drink after drink. And then as this individual would transition through what would be the general course of life, it requires much less each time for them to be able to get to what is that same status of alcohol effect, basically. And so then someone who may have previously had, say, 10 drinks before they started having this sort of effect, then before they even be done with one, then they are having this sort of effect. And then this person now goes to the stage of what we would refer to as a club. This is the person who is now, yes, years after, being thrown out of the bar. The handlers do not want the person associated with their center, establishment, and so forth. And so we simply need to come to a place, I would say. People might say it's easy for me, as you know, a doctor who would suggest that perhaps not necessarily only specifying in terms of the quantity, but just in the mere social habit of alcohol, that this is something that we can actually perhaps and should try to avoid to be able to change the culture on a whole.
Topics I would like for us to explore as well is you mentioned in your psychology course about looking at the lifespan of alcoholics and persons who abuse alcohol, rather. And I would like for us to have a conversation as to what are some of the trends that we tend to see among younger persons when it comes to alcohol use. So Mrs. Byron-Caines mentioned that in the survey from 2013, that the first use of alcohol was somewhere between 11 and 9 months to about 12. So outside of that statistic, or if we can even explore that a bit further, and perhaps Superintendent Henry can chime in the conversation, what are some of the trends that we tend to see taking place with young persons and alcohol use?
Sure, no problem. So looking at that same secondary school drug prevalence survey, we asked the 600 plus students who participated, which was a representative sample of the entire school population, how many of them would have had at least one drink of alcohol in their lifetime. And based on the results, we had 65.5% indicating that they would have already had alcohol. Higher among females, which was 69%, and 41% for the male respondents. We then asked them how many would have had at least one drink within the past year. We had 44.5% indicating that they would have had in the past year. And for the 1 month prevalence, meaning March during sports term, during school term, 25.9% indicated that they would have had alcohol within that past month. And what we are realizing from the statistics as well, we try to assess parent-child relationships. And what the study showed us is that children who reported better relationship and communication with their parents, they drank less substances than those who were not satisfied with the parent-child relationship or communication. There were quite a bit of other substances we looked at, but specifically for alcohol, those were some of the findings that came out in that study. We also realized too that at the time of the study that enough prevention and education discussions were not being held. So that is something that we try to address, hopefully when we do our next survey, either in 2023, but definitely by 2024. We hope that when the children report on prevention and education at the schools, that it would be different. I think the first one, they indicated about 75% said that they never had discussions surrounding substance misuse or abuse. And so we are really trying to get into the schools now to educate them about the effects of alcohol and other substances on your brain, on your body, and on your well-being. It's definitely an area for us to focus on. So that is some of the statistics that we're seeing on that end.
Well, from the police perspective, I do not have the statistics here in terms of the age of persons who are driving under the influence. But we know most of our drivers, all of our drivers who are legally driving are over 18. And so they are of the legal age where they can drink. So we would not have statistics of persons younger than that who are consuming alcohol. But from my personal observations and experience, most of our accidents are late night accidents, 2, 3, 4 o'clock at mornings, where drinking is a cause of the accident. They involve persons who are between the age of 18 and 35, young persons. And these are the persons who patronize the bars and the clubs. And most times, by the time they're leaving the venues, these venues, they are so intoxicated that they cannot reach home safe. And so the persons, from my experience, who are involved in accident under the influence of alcohol are younger persons, the age group who socialize at the clubs at nights and leave early in the morning.
So I just want to chime in. I mean, there's a very interesting piece of that statistic that I think is not lost on me and certainly should not be lost on anyone. Is that disparity in terms of, male to female, and I think that's a very interesting trend. I think it's 44% for male and 65% for female. That's certainly interesting for a number of reasons, because we spoke of, and I think one of the things that I think we hope to do here is perhaps look, and perhaps beyond this discussion, is how we harmonize our approach to what healthy drinking levels are, consistent with what the rest of the world, and I think the U.S. has done a good enough job, and certainly not perfect by any measure, but it's so much more nuanced in terms of alcohol intoxication and how much you can consume, right? Your body weight is an important measure, and that's why for a female, typically it's recommended as to 1 drink a day. Perhaps, the CDC has placed that, that guideline for a healthy diet, which is 1 drink per day for a female and 2 for a male, right? So when you speak of the fact that women already, the initiation is already taking place a little earlier, that is certainly concerning. So body weight is an important measure. Also time in which you consume alcohol. If you I'm going to just disclose here, and proudly so, that I, in my former life, was very, very strongly involved in Carnival. I was, a big part of a Carnival band, and still one of the biggest Carnival band in St. Lucia today. And that was one of the things that, I have to say that morally and ethically, you're a little conflicted, because I love Carnival. I love the art form. I love music, right? I think if we look at why Carnival exists, from a cultural standpoint and how, what our cultural heritage, what that means for us, it's an important activity for us to have. I also recognize the challenge for the business person, right? Because that is a source of revenue. The challenge of Carnival is that so many of these businesses can only be myopic in their approaches, because you have the pop-up shops and bars that are only seasonal, and you want to make as much money as you can because you invested in that, right? Mm-hmm. So that becomes one of the challenges, because the business community, I had a show just last week, which Dr. Tate was unfortunately able to make, because she was supposed to have it on the panel with men, and we were talking about men's health issues and men's approach to thing, and I had an individual who is the general manager of Cost Cap Coca-Cola here, and we were talking about healthy drinking and sweet sugary beverages, and I was very happy to hear him speak about the fact that they're not in business to make all the money all at once. They're in business to have a long-term, 100-year business, and for that to happen, you must have a healthy population. If you consume all the alcohol you can in 10 years, and as patients say to me, "Doc, you took my license away," and I take your license away, said you cannot have any alcohol because you have an underlying condition that prohibits any alcohol at all, right? All you've had, the lifetime value of that customer is just 10 years, as opposed to a healthy drinking practice that extends that lifetime value, that a customer can buy a drink from you from time to time and consume it for 25, 30 years, because we can do both things at once. We can appreciate what is our culture. We can consume alcohol in healthy levels, right, of it, right? Because I think if we said anything to the contrary in terms of alcohol is bad and alcohol is, and as a doctor, it's a challenging place for me to find myself, because I recognize that culture, and I recognize how difficult it is when you look at different stakeholders. The person who, alcohol is addictive, right? It is addictive. People who drink alcohol, there's an alcohol dependence that takes place over time. That, so those are, so it's one of those things. So I think how we break this down and how we get to the point where we determine what is a safe alcohol level for someone to take, body weight, the amount of alcohol drinks you consume in 40 minutes or an hour, right? Those things are things that help us to determine at 0.11, a blood alcohol level, which is considered intoxication, how do we delay that in terms of how drinks are served and to whom it is served? But that's a very, very interesting. Michelle, I want to get some more information about that later on.
All right, so most of the conversations so far has explored alcohol consumption, but the topic includes a healthy drinking culture that also focuses on sugar-sweetened beverages, also known as SSBs. We are also going to have a conversation about that when it comes to the particular trends as it relates to sugar-sweetened beverages. Abby, in her opening comments, would have mentioned about our fight against non-communicable diseases, of which diabetes is a part of. And so I would like for the medical doctors to first be able to chime in on some of the trends and why we should be so conscious of our drinking of sugar-sweetened beverages. So Dr. Tate, you can start first.
So we would simply point out that sugar is essentially the enemy, okay? When we have what is an excess of sugar, and I think perhaps what many people might not be aware of is the mere fact that excess sugar is ultimately then converted to fat. So if we look at our population in general, we know that we generally have what is an overweight population. I'll try and stay away from the word obese population, but nonetheless, we have a generally overweight population. And to be quite honest too, in many senses, it is in fact quite glamorized. We like to see ourselves, you know, with the hips and, you know, the derriere and so forth. And so then this is actually one of the things that we celebrate within our culture. But in terms of the long-term effects of, you know, obesity, we have multiple. Essentially, what would be particularly, I would say, the cardiovascular diseases in particular, so, you know, heart attacks and so forth, and of course to the non-communicable chronic illnesses in terms of hypertension and diabetes and so forth, which of course too have their own spin-offs as it would relate to kidney disease and whatnot. So essentially, if you're looking to get ill, then you can divulge rather in what is an excess of sugar. So essentially what we need to do is simply to cut down on the sugar quantity. And I'll be the first to admit, as I had admitted to Karimu right here this afternoon, which is that I'm actually a sugar lover. And so then, you know, having to sit in my office and often remind and even scold my patients about what is an excess in terms of the diet and so forth, when I myself, you know, still have what are the obvious challenges with sugar. But again, what I would always remind people of is that the more sugar that you consume, then the more that you are required to consume, because the body, in terms of what would be the cravings and so forth, the more you eat the sugar, the more cravings you're actually going to have. And so then if you're able to limit what is the sugar intake, generally by about the third day, then you find that the urge for these cravings would actually resolve themselves.
So that basically you're saying the rum punches and the pina coladas, anything that is extra sweet in addition to the alcohol, is not good at all.
Anything that is sugar.
Dr. Pierre?
Yeah, I remember I just, you know, I'm sitting here and I'm looking at Abby's shirt and she says, "You're sweet enough," and I'm thinking of sugar mass in my mind and I'm wondering how these two things come together. And they're not polar opposites, right? I mean, you know, you're sweet enough because this is sugar mass, right? Mm-hmm. But it doesn't mean that. I remember, you know, when I moved here, I was working at GNF at the time, and that's when I became acquainted with the sugar mass. I had never heard it before. And I remember seeing the posters around, and at that time I was struggling with my diabetic patients at the time, trying to get them, you know, and I'm saying, but if this is a big branding for the country, how do you fight that? Right, you know, sugar mass, and you know, so sugar is good, right? So suddenly sugar has been sanitized, and you know, so for me, it's you know, Dr. Tate mentioned her love for sugar. I don't call it sugar; I call it cake. Which just happens to have sugar. So you know, it's not uncommon for you to find me walking across right here at the Marriott to that little place where there's the brownies and the chocolate cakes and the, you know, and so that for me is, if you, that's my weakness right there, right? Chocolate, anything with chocolate and cake together, it's Yeah. So I recognize the challenge. As a medical doctor, I'm also a human being. I live in this culture, right? We all have what we enjoy. But the question is, I think we're here to talk about how do we strike that healthy balance. So it's not just about what you consume, it's also what you burn. Because the reality is, you know, the sedentarism that's tied to all of this is also something that we have to be concerned about. So I'm having my slice of chocolate cake, and then I sit and I perhaps binge on Netflix, where it's a Bridgerton or whatever I'm watching for the entire weekend, and I have not left that couch, right? So it's, you know, it's not just about that slice of chocolate cake, it's what am I doing with those calories that I've consumed? Am I burning it out? Am I doing so in a healthy way? Most would you go to a bar, like, you know, if you look about the street last night, and you see the demographic that Superintendent Henry spoke about in terms of accidents, guess what their favorite choice of drinks are? Cocktails. The pina coladas that you spoke about, right? So these are the folks who enjoy spirits. It's a cocktail for them. So there's all that sugar on top of the alcohol. And we are struggling with those NCDs. I mean, that is the biggest economic and developmental challenge we face. We cannot grow and build an economy when people are getting sick so quick and dying so early. And that's the reality. That's where we struggle. So I think if we stick a pin here for a second and recognize that this is not an attack on alcohol or on sweets. Dr. Grant-Tate, I didn't know. I didn't know she was a sugar lover. But again, sugar mass, sugar country, sugar St. Kitts. You know, we all struggle. Sugar is as addictive as alcohol. Sugar is actually more addictive than cocaine. Right? There's studies that have shown that rats, when they found sugar, left cocaine alone, and it was sugar. There are studies that show how addictive sugar is. So we're not just fighting a habit, we're fighting an addiction. And how do we then become sensitized to what those effects are, what the impact of it is, the obesity that we see around, and how early. I have been a doctor for 22 years, and I can tell you that when I started medicine, if I saw a 16-year-old, I was almost certain that this was type 1 diabetes. Not today. When I see a 16-year-old, it might be type 2 diabetes, which is in many ways preventable, right? So it means that the onset of those diseases is so much earlier. We have people in our renal unit on dialysis who are in their 30s. That is the reality. So that's where we face, and I can tell you, the cost of caring for those diseases, the burden of disease, because all of society picks up that tab. All of us pick up that tab when somebody gets sick so early and somebody has a disability because there's an NCD that has already started at such an early age.
Wow, Dr. Pierre, you would have spoken to some of the economic challenges, and we want to explore further as well. What are some of the societal challenges that we tend to see, and perhaps Superintendent Henry can chime in here, and Mrs. Byron-Caines, as it relates to excessive alcohol consumption. So what do we tend to see be some of the results or the challenges surrounding this type of alcohol consumption, abuse rather?
Okay, I'll go. Some of the main challenges we're seeing includes relationship difficulties. You find a lot of the calls we receive involving domestic violence. For instance, you would have the violator, the one who comes home extremely drunk. He would have had excessive amount of alcohol, and he comes home and he abuses his family. There is emotional and mental challenges related to it as well. Henry would have mentioned it earlier about the accidents that we're seeing in society as well. So we have the relationship issues, parent-child, spouses, domestic violence. We have issues related to accidents and incidents, and the health challenges as well. So we have quite a bit. I'm not sure if Henry will have statistics on his end, but it's overwhelming. Especially with domestic, we get calls from gender affairs often, with high levels of abuse. We have the teenage pregnancy as well. One of the concerns we have coming on to these festive seasons as well, and we're really trying to get out into the schools because we have those young vulnerable children. Well, let me reverse that. We have adults who take advantage of the young children, give them alcohol to a point where they're not able to focus properly. And there's stuff like date rape. you know, they take advantage of these children because they're not mindful of what they're drinking, who they are receiving it from. So it's a lot of issues that we're dealing with, emotionally, mentally, really, on a relationship-wise, that we really have to focus on going forward.
Well, for us, one of the challenges that we have with alcohol, Ms. Caines would have mentioned the domestic abuse. Those calls come to us. We have to respond. And most times we would take away the intoxicated party from the home because there's no point leaving him there because we're going to get a call later in the night. So once we find that a person is intoxicated and engaged in some domestic violence in the home, we usually take them away from the home and keep them in custody. We now have the challenge of keeping that intoxicated person in a cell. He's talkative, he sings, he shouts, he screams, he pees in the corner, he calls everybody name who he knows. So the police get no break once you have an intoxicated person in the cell. So we have to be making regular checks on him because we do not want him to hurt himself in the cell. So we have to make regular checks on that person to make sure that they're okay. Sometimes we have to take them to the hospital, you know, for some sort of medical intervention because a lot of times they are diabetic and then once they get drunk, there are other medical issues, we have to take them to the hospital. So the police are kept busy taking care of that intoxicated person whom we would have taken in custody. Of course, the accidents that result from alcohol consumption, that is another challenge in terms of the costs. Last accident that maybe about 2 or 3 weeks ago occurred on the main road just outside Contact. We've had to call out the fire truck. This happened after 4 in the morning. We had to call out the fire service to cut one of the passengers from the vehicle. That took over an hour. That is a cost to the state because the equipment that is used, the fuel that the truck uses, you know, all that it takes to remove that person from the vehicle it's a cost to the state. Then there were 2 ambulances on the scene. The medical staff had to be there while they're taking out the person from the vehicle. The medical staff is making sure that they're okay. So all that activity from the medical services, the fire services, the police, for well over an hour. I think it was about 2 hours, if my memory serves me correct, that we were there on the scene tending to that accident. That is a challenge for the state. It costs. And then, once that person is removed, he has to be treated. They may have to call out some technologists from who is on call to do x-rays. The doctor has to be, if the doctor is not at the hospital, he has to leave his home to come to the hospital to look after that patient. So that is a cost to the state, and it is a challenge. It was just about a week ago also, we had a cruise passenger. They too present challenges to us. Because for some reason, when tourists come to the islands, they think it's a license to drink. They cannot drink as freely in the US because they are very strict on alcohol consumption. And so when they come to the Caribbean, they think this is our time to drink. So there was this couple who was at a bar at Port Zante, and by the time they were ready to go to the ship, they were so intoxicated they couldn't walk. And the wife, she passed out, had to call the ambulance to take her to the hospital. The husband, he was very aggressive and talkative. And by the time he got to the ship, he tried to stagger to go to the ship. By the time he got to the ship, his luggage was on the pier. The captain put him off the ship because the ship policy is you cannot be on the ship and be intoxicated. So the captain put him off the ship. He's now in our care because the ship agent said, well, it is your fault why you get thrown off the ship. So the ship agents said they're not going to have anything to do with him. So they called the police, and the police had to take him in custody and kept him overnight, and then assist him in getting flight arrangements for the next day. So we had to spend considerable time dealing with that individual. We had to contact his family in the US, just to let them know that where he is and what had happened to him. So these are some of the challenges that we as law enforcement face dealing with persons who are abusing alcohol.
And just to add in a bit, to tie it into Carnival as well, we know when you have the juve and the parade, a lot of alcohol is,
right.
Yeah. And I'm amazed at how many fights that the officers are called to pass, yes. Because another sign of too much alcohol, you become really aggressive. And I was just confirming with Merisa here, Dr. Tate here, because I remember we had some training where we tried to train frontline workers in drug prevention, drug treatment, and education. And one of them was sharing with us that the A&E room, especially on Juve morning and parade day, it's full of persons who are there because of alcohol poisoning, drinking too much alcohol, or as a result of some fight or accident and injury. Yeah. So that's another strain to society as it relates to the consumption of alcohol.
And our cells, our police cells, are also filled with those same people and Juve. I could recall last year we had about 40 persons in custody after Juve. 40. No, sorry, not last year. The last Juve, outside Juve that we had. Sorry, the last outside Juve that we had. We had about 40 persons in custody.
But you know what the sobering reminder is, and I most of my career has been spent in emergency rooms. That's right. That's my field. So I kind of understand this firsthand. But I always tell individuals, as somebody who has done a lot of mass casualty training, that a mass casualty in St. Kitts is 3 people. That's what it is. If there's 3 individuals who need surgery at the same time, 1 person has to die. That's the reality, because you almost cannot operate on 2 people simultaneously with serious injuries in this country. So 3 people. So an accident that involves 3 or more people who are seriously injured, somebody or some people will have to die, because you can only really care for that number of people. So those things, I think context matters, right? In terms of, it's not just about, but in St. Kitts, why this problem is amplified, because you look at this, and I'm not sure many of you saw Dr. Wilkinson's retirement. So we're down 1 surgeon in the country, right? So so those are so when I think of those things and we speak about them, I like to tie them back so we can actually, so they're a little less abstract and less anecdotal, but we think about what would happen if you're driving intoxicated and you have 2 or 3 of your friends in the back of the car, and you're in a serious accident. Perhaps you should start thinking, which one of us would have, and we're all the same age, so it's not based on age or whatever, that triage. It's just, the luck of the draw, right? The person who survives and the one who dies. So that is also something I think really just tempers some of the emotions around that, in terms of, no, they're trying to stop the mass, or trying to stop the alcohol. No, we're trying to save lives, and that's the bottom line. Whether it's accidents or whether it's saving lives in terms of delaying the onset of a disease that alcohol is going to actually cause to perhaps show up earlier. So I think that's also an important context to be made.
Well, Dr. Pierre, you've tiptoed right perfectly into the next area that I wanted us to discuss, which includes the implications on public health, what the implications of alcohol consumption and abuse and the increased risk factors for non-communicable diseases are on public health. So you have really painted quite a picture, which was quite shivering for me actually, in terms of what it means for a mass casualty and one will have to die and one could have to die. But what are some of the other implications? Perhaps Dr. Tate can start first, as it relates to public health and the increased risk factors for non-communicable diseases.
So just to quote Dr. Patrick Martin, as he frequently would remind us in the health setting, which is that there are two issues that primarily keep government ministers, particularly what would be the Minister of Health worldwide, up at night, and that would be cancer and what would be kidney disease as well, or kidney failure. In other words, patients who then have to receive dialysis in particular. And when we examine the effect, I would obviously speak more to what is that of cancer as it would relate to cancer. But just to point out that alcohol itself, or ethanol as we would refer to it as scientifically, along with what is the first metabolite of when alcohol is being broken down in the body, which is what we would refer to as acetaldehyde. These two, so alcohol and its first metabolite, they are actually considered as group 1 carcinogens. And a carcinogen is simply to say a substance that can lead to or cause the onset of a cancer. And group 1 is to say that they have what is literally the highest capacity of being able to do so. Just to add as well that the actual acetaldehyde is actually also very toxic. That is another thing. And while it is that it is being converted, in other words, from ethanol to acetaldehyde, in the cells that it is converted, you have what would be some pretty detrimental effects in those particular areas. Primarily what would be the mouth as a result of it occurring in the saliva, as well too as what would be within the bowels as well, so the large bowels. The liver being the first and most relevant of these places, and quite a few others. So in summary though, alcohol on a whole, it is, and just to highlight as well, because one of the things that we spoke about here at length so far has been in respect to what has been the quantity in terms of the consumption. But quite sadly, there's actually no lower limit for what is the association of alcohol and these diseases. And so then what we do know, for example, when we compare what would be or what is otherwise known as the population attributable fraction. In other words, then, when we remove this risk, so in countries where it is that you have higher proportions in terms of alcohol consumption and so forth, then you obviously have what would be a much higher incidence of the cancers that are associated to the alcohol consumption. And then in countries where alcohol consumption is actually illegal, then these very same cancers are almost at zero. And that is something that we need to, reiterate to the population. And as I said, there is no lower limit. And so then even though you have what is the increased risk of these cancers from the alcohol consumption, we basically have to reframe the term in terms of alcoholic. Because, there are many cancers that we refer to, and we would say, well, as an alcoholic, for example, that of the pancreas and so forth, breast cancer and whatnot. But simply for you to be able to consume what is essentially just that one drink a week, or that drink that you have on the weekend, that alcohol drink on the weekend, even if it's just one, that is actually sufficient to be able to offset what is the mechanism in terms of cancer and its outcomes.
And of course, Dr. Tate touched on cancer, which is her area of specialty, and there's no surprise there. But I mean, there are the other things that we talk about, the other NCDs, right? One is mental health. Alcohol is actually a depressant. So the person who drinks alcohol because they're depressed only gets more depressed over time. But we've made so many unhealthy associations to alcohol. For example, Guinness as increasing sexual prowess. And that's not knocking Guinness, right? But it's the fact that there are men who literally believe that if I drink 2 or 3 Guinness, I perform better in bed. And that is not so at all, right? But that is very hard to actually decouple that in someone's mind who believes that I do perform better when I drink 3 Guinness, right? And the more Guinness, the better. So those are some of the unhealthy associations and I think, just realizing that not only do you, after you've drunk 3 Guinness, you perhaps perform better, but sometimes with whom? Because when you're impaired and your judgment is impaired, and I think, Dr. Caines spoke about, the abuse, right? The sexual abuse, but the STIs. You know, a person who is intoxicated cannot negotiate the conditions under which they actually have sex. A young girl cannot say, for example, or a young man cannot say, let's use a condom, right? So STIs, HIV are also important things. But one thing that is perhaps a sobering reality for me is something called disability-adjusted life years, productivity. Because we have medicine. Medicine has done great in terms of improving people's quality of life to some extent, if you will. But so people are living longer. Yes, we have, you know, people aren't dying from infectious diseases in their 40s anymore. They were living longer, 70, but what is that quality of life for the last 30 years or so of their life? And that for me it struck at the heart for me when I was in Jamaica in a panel just a few months ago. And, you know, in that panel, one of the panelists was the president of the American Heart Association, who happens to be a Guyanese, but she's a renowned cardiologist in the US. And she presented disability-adjusted life years, and irrespective of the health systems, so, you know, there are health systems that are slightly more equipped throughout the Caribbean, disability-adjusted life years was pretty much the same throughout the region, in the sense that every one of us is living about 4,000 years of life in our population, because people are alive, but they have years in their life, but less life in their years, in the sense that they cannot, the person who is amputated because of, you know, of diabetes or whatever the case, we cannot be the bus driver, cannot be the construction worker, right? You know, so with the exception of Guyana, which is 7,000, all the other countries, irrespective of the health systems, are about 4,000 years of life lost every single year to disability-adjusted life years, and that's connected directly to non-communicable diseases, things that are mostly preventable.
I think our doctors are giving us quite chilling, statistics that is really, really tugging on us mentally as to change in behavior, and that is really the aim of the panel discussion today. How do we create a healthy drinking culture, not only for alcohol beverages, but also sugar-sweetened beverages? All right, so what we're going to start to talk about now is because I think we just have about 30 minutes more for the conversation. What we're going to start to talk about is the changes that we would like to see for Carnival. So the overall topic was reimagining Carnival, creating a healthy drinking culture. And some persons might not be willing to agree that it is possible to create a healthy drinking culture as it relates to Carnival. Dr. Pierre would have touched on the topic earlier as to what these changes would mean for our small business owners as well as suppliers in terms of them being able to earn that revenue, make that income, especially during these particular times of year. And I think it's even more so outside of Carnival as well. We can also think about the music festival period or the Culturama period. So I think we should start the conversation there as it relates to reimagining Carnival and creating new drinking cultures, but the changes that we are suggesting to be implemented, what would that mean for our small business owners and for our suppliers? Any panelists want? Okay.
Well, you touched on the impact of what we are doing on small businesses, and that has been our experience. A few years ago, we embarked upon really clamping down more on driving under the influence of alcohol. We had acquired some breathalyzers. We have legislation, by the way, again, for that authorizes us to do that. We had acquired legislation, and Ms. Marlowe here could recall that training that we had over at the Angelus. We acquired equipment, the breathalyzers. We brought in someone to train our officers in the use of the breathalyzers. We sensitized the magistrates, the lawyers, defense lawyers. We started really on the path of getting serious on alcohol use and driving. And we got pushback from the business community, those who are engaged in the sale of alcohol. they see it as an attack on their business. They saw it as an attack on their business. We would have less alcohol sales. Persons who have shares in businesses that sells alcohol would be making less dividend. And the pushback was stronger than I thought, because they were able to kill our drive, and that never get off the ground. And so I'm not surprised what Ms. Harris would have said about what the business owners would say if we begin to suddenly tell people stop drinking, then, or tell them just drink 1 beer instead of 2. The bar owner would say, well, that is 1 beer less I'm able to sell. You are affecting my business. But they do not look at the big picture. They do not look at what we are trying to prevent, which would cost the country more than what it would cost them in loss of sales. And so that, to my mind, is a challenge. But I think we must find a way to overcome that challenge. So rather than saying let people drink, why not encourage them to drink more responsibly? If you are drinking, then do not drive. There are other alternatives that you could use. You could use public transport, have someone with you who is not drinking. If you're in a group especially, have a person in the group who is not drinking to be the designated driver. What some bars do in other countries, and I think it may be something that we could explore here, is that the bar owner would, once you identify a person in the group who is not drinking, who is the designated driver for the group, if you're hanging out in a group, then that person gets non-alcoholic drinks free. So you stay in the bar all night and you drink soft drinks for free, while the rest of the group who you're supposed to be driving, they would buy their alcohol. And that is one way to encourage persons to avoid becoming victims to traffic accidents as a result of their drinking. I will leave it to other panelists to make other suggestions.
Sure, I'll contribute here. And I remember we had some discussions about the breathalyzers, because there is actually something in legislation pertaining to that, but because of the pushback, we were asked, ease up a bit.
Ease up a bit.
Yeah, so it did stop the momentum. There are other legislations as well where you're not supposed to sell alcohol to persons under the age of 18.
Yes.
Right? We also have other things. World Health Organizations and other international organizations would have presented other evidence-based practices on the age sale of drinking, preventing persons who are already drunk from continuing to drink. And we have that in legislation as well, where if a bartender sees someone and they're already drunk, aggressive, misbehaving, according to law, you're not really supposed to continue selling substances to that. But it's not necessarily enforced for various reasons, but it's something that we can revisit. I think what we can do as well is offer bartending, maybe training sessions. I know hotels and the bigger organizations do stuff like that, where they can identify people who should probably stop drinking at a certain point, and offer them other drinks. Okay, here is a drink, non-alcoholic beverage, to allow them water would be the best, of course, to try and get them, a little bit more calm, not drunk. But another area is that we always hear drink responsible. And I think the onus will be upon the individuals and you, among your friends, your families, to drink responsible. And we hear it all the time, but some persons really don't know what it means to drink responsible. And so there are 3 different categories that we normally look at before you go out. Make sure you're well fed, your stomach, you don't want to start drinking on an empty stomach. So eat a well-balanced meal before going out. You want to make sure that you have a designated driver in place before going out. If you're going out with friends, make sure that you have friends who would say, okay, Merisa, you had enough now, here's some water, we're taking it easy, we have an eye on each other, we have our friends, our circle, our community helping us to monitor and acknowledge how we are behaving, what we are drinking. Know your limits, not because you see others drinking 2 and 3. If you know your limit is 1, stick to the 1. So these are things you consider before. While drinking as well, we also encourage you, again, if you start to feel hunger pangs, while drinking and reveling, stop, have a full meal. That helps a lot. In between drinking, instead drink of water. So maybe have a drink of alcohol in your cup while you're fetting on Juve morning. But instead of having all alcohol, add some water in between as well. And that will help you not get to that drunken state. And there are also at the end, just make sure you're not driving under the influence. These are simple tips that you can do to help prevent, regrets and embarrassment, accidents, you name it, and death, that's right. NCDs, the long list of things that could happen. So these are some tips that would be upon us to implement as an individual.
Sure, Dr. Pierre?
Yeah, no, I was just, just a couple of things. I think, I spoke of not just in terms of alcohol that is consumed, but the time in which it's consumed. It's essentially like creating that gap, and we spoke about using water or some other beverage. So there's a term that we heard a lot during the COVID pandemic, which is run on the grocery. I think we're going to live here for a new term, run and rum. You don't have to drink 2 drinks in 15 minutes, so you can space your drinks. So don't run on the rum. You're there for the fete, you're there for a couple of hours, space your drinks. Have a drink, have a bottle of water, and if that's one of the things I think that would help in terms of limiting consumption and all the other things we spoke about in terms of accountability. But I'm going to just use the little knowledge of business that I have to speak to the business community and why this is not necessarily a bad approach. If you're a business that's well functioning, if you're a business that is in the business of being in business for a very long time, here are a couple metrics that make sense to you. A lifetime value of a customer. In a small economy like ours, your goal to be in business and to be profitable is repeat business, having that same person come back to your business over time. And the longer that period is, the longer you can keep that person being interested in your product, the more profitable your business is. And this is particularly important for a small economy. We don't have economies of scale in the region, right? We're 70,000 people. We have a labor force that's under 7,000, I think, last my check, right? Of people who are permanently employed. We have individuals in the gig economy, but the people who are gainfully employed, it's a very small market. So when 2 or 3 lives are lost, you're losing customers. If somebody suddenly has at a very young age, when they're perhaps earning the most money, that's when it's being spent on healthcare as opposed to entertainment, you've lost a customer. So you may not see the benefits of this in this sugar mass, but I certainly believe that if you're strategic enough and if we can work with the Chamber of Commerce and they understand that this is not taking away business, this is perhaps guaranteeing customers for a longer period. So we can strike that healthy balance. Because you have a small economy, you need to have repeat business, you need to increase the lifetime value of your customer, and you need to be able to increase the average spend. Which means that when that person is in their 30s and they're in a stable employment and they're earning, they can come to your establishment with their family and their friends, they can enjoy a beverage and they can pay for it and they can buy top shelf. Right? So I'm not encouraging alcoholism, but I recognize why this represents an existential threat to a business, but it doesn't have to be. Because we're saying that there's a way to create a healthy population and create businesses and also rethink some of the cocktails and things that you serve. Perhaps in bartending training is also about how much alcohol you pour, because I've had certain drinks and I've had to say to the person, that is too much alcohol in that. For me, can you add some more? So I think part of the training is also about how much alcohol do you need to really pour in this for this to be an enjoyable drink and for the person not to be intoxicated by halfway through the first drink they're having. So as a business community, I think that's the discussion that we need. I think that's a very sane type of conversation to have that shows that, we are in this together. Unless we are getting to the point where, and I'm going to go just quickly into healthcare financing, because otherwise, I think we have to push for a healthcare mandate, because you cannot be pushing for individuals to drink and you're not providing insurance to the people who work in your establishment, because that's it. Because if we want to make money all the time, let's pay for the care that people need, right? And that's where and there's also pushback there, because they say, Well, you can't employ people unless you guarantee that they have access to health care, that they can pay for it with health insurance. Let's have some healthy discussions. So I think reimagining our culture is not changing it, but recognizing where we're headed. We're headed down a path where very soon in this small country, unless we start bringing people in, you know, the growth rate is 0.6%. People are making kids these days. So population isn't growing. It's not, which means that you are not getting more customers. That's what it means. So don't kill them today. That's the reality. That's the reality. Don't try to make all the money in this sugar mass. I want to have sugar mass for 15 years, but I want to see the same people come back and they're healthy and they not come today and you amputate it next year and you can't play mass as an amputee. I haven't seen it. Maybe it's possible. I have not seen an amputee play mass yet. Just saying. All right?
I'm sure I can find an example for you. But as we continue the conversation and we think about the type of drinking culture that we have, and especially around the Carnival time where you have fetes that are all you can drink, and they'll say to you, you can't done the rum, but persons will come with an expectation to try to done the rum, and then they end up in very uncompromising positions. And then we have different cultures practices rather that might include pre-gaming, trying to drink as much as you can before you go out so you don't have to spend as much money on drinks when you do reach out. How do we reimagine a drinking culture and carnival with these present realities? and Mrs. Byron-Caines already started to break down what drinking responsibly looks like, and I really love that she did that. And if there is any other panelists who would love to chime in on some other tidbits that persons can bear in mind, because we also do have a culture as well that is very heavy on peer pressure. And so if you go out, and it has happened to me on many times, I'm like, okay, well, I'm not drinking. How you mean you ain't drinking? And you are bullied into having a drink. Or, as you were mentioning, when your drink is being poured, that's enough alcohol. No, that's not how we do it. And they continue to pour more. So how do persons really survive and change the culture with these types of realities? So I gave you 3 questions.
Well, I just want to emphasize on the importance of family, because obviously the family is the single most important unit as it would relate to what is the community. And in particular, I think that it's so often that we as parents, and I'm speaking from the point of a mother, that we undervalue or we underestimate just how much of an impact it is that we can actually have on our children. And so we often hear, or we've heard a few times, that it is so much easier to build strong men as opposed to, or rather build strong children as opposed to repairing broken men. And one of the things, for example, with both of my kids, but my daughter in particular, she's just 13 years old, and can I tell you, she is literally the most confident person that I have ever known in this lifetime. And I'm quite proud of that, because it's also something that I get quite a bit of feedback from what would be the different activities that she's involved in, and more so in school and so forth. And one of the things, for example, because much of what she does, obviously, and this is why I emphasize in terms of the impact that we have as parents, much of what she models herself on would be as of a reflection of how she views me as her mother. And obviously, I'm one of those, straight persons when it comes to alcohol. Even if she's not present, it's simply just not part of what I would ordinarily do. And can I tell you that my daughter, she never asks for what is anything that is alcoholic, not even the bit of punchy Cuba. She's halfway through high school, at 13, she's in 3rd form. And even what is the mere sparkling cider, which has no alcohol at all, she actually likes that, and I allow her to drink it. But even that, I have a problem with her drinking, because, you know, the way I look at it is that, well, you know, this is giving you that bubbly feeling, and, you know, at least in the mouth, which is pretty close to the effect that you might get with alcohol, even though it doesn't actually contain alcohol. And so, no, I don't want you overdoing with this. And so that is, you know, the approach, you know, that I pretty much have with her. But just to emphasize again that, you know, as parents, if you're going out and you're getting sloppy drunk, and, you know, you're coming home so incapacitated, or even if it is that you're coming home with what is the smell of alcohol. And I go back again to one time when, you know, we would have been out eating, and I would have ordered a virgin colada. And the bartender, when they would have prepared it, it actually came back as just what is the pina colada. So, you know, it had in the alcohol.
And what we need to be addressing is the behaviors, and I think we've touched on them. And I think education, more education would make a difference. I think if persons constantly hear about the impact of alcohol use on their lifestyle, I think we would see a change. You know, we get a lot of advertisements about how good alcohol is. The companies who sells alcohol, I mean, when you see them advertise their product, you want to go and buy more. You know, they now come in different flavors. I'm seeing tropical flavors. They have mango, guava, you know. So they're more attractive now. And when they advertise with ladies in bikini. We see it on our television nightly when they're advertising the beer. And they have models in bikini advertising the beer. And so the beer now becomes attractive. And so maybe we need to also, with the same vigor, promote or educate our consumers on the effects, and so that they have an informed choice. Are you going to choose the alcohol that is being advertised with the lady in bikini, or are you going to stay away from it because of the impact that its use would have? And so I think education would be important. It's the key to reducing or reimaging our culture, so that we have healthier use of the alcohol. Thank you.
Yeah. So I just want to highlight one of the points that Colonel Henry made, which was just how this is linked to a culture from my grandmother Priscilla, who sent me to buy brandy to dab her knee for arthritis, and then take a shot while she's at it. My grand aunts from the UK, if I had a belly ache, would use gin and rub my belly with it, you know, and then give me a little shot to take and see that. And oddly enough, my memory for some reason or the other tells me that worked back in the day. You know, and then, you know, I'm not sure what you call it here in St. Kitts, but St. Lucia, for example, a tea posh, what they call it, is this very strong rum that's used to break the fever if you have a cold, right? You know, so somehow, in some form or fashion, even when there's health, alcohol is somehow intrinsically linked to our culture. Yes. But the FIFA World Cup is going on. Have you looked at the boards around sporting events? Sponsored by alcohol, Heineken and Smirnoff vodka, right? So the very same event that is supposed to be health-based physical activity is sponsored by alcoholic brands, right? So, you know, I'm painting this reality so we understand what we're up against, just how in your face it is. I mean, to your point, the ads are very catchy, very appealing. And it's so ubiquitous in our setting that, you know, everywhere you go, there isn't a single place you go where alcohol in some form or fashion isn't being offered. But the question is, how do we strike that healthy balance? I think as a medical doctor and from the standpoint of the Medical and Dental Association, the challenge first is that we only get to have that conversation when we were taking the license away, saying no more alcohol. I really wish that that this becomes part of the discussion, not only around the dinner table, but in that room when we approach to preventative health, right? So we're talking about that healthy culture. And I think if we continue to reinforce that message in our schools, around the dinner table, right? Little groups, I've been part of groups here where for some reason, around the Lenten season, if you go around town, people try to stay away from alcohol, and if you're not having a drink, suppose I'm not buying you any water. If you're not having a drink, I'm not spending money on you. That sort of things. Right. So the peer pressure is real, right? But how do we, as small groups and small communities, how do we begin to have that discussion? How our churches reinforce it? I think everyone, and we speak about the all of society approach. That has to happen. So there has to be that sort of accountability in terms of each other. Right, and you're doing it not because you want to sort of impose anything on anyone. It's because you want that person, because it's a way to show that you care. I care about you. That's why I'm actually saying, I think we've had enough. Let's stop here. So the bartenders, the business owners, we are not, when you're in that bar or the owner of that establishment, you are not immune to the effects of that, because that is happening within your own home as well. So I think having healthy discussions around that, striking that healthy balance in terms of exercise and calorie intake and those things, I think that's really going to help in terms of how we approach alcohol intake and recognize that the two things are not at odds with each other, right? There's a way to have a good business. There's a way to have an enjoyable social sort of milieu or dynamic, and there's a way to actually just measure how much alcohol you're taking in and what the real impact of that is.
When we go out into schools and different organizations to do education and prevention, I know many people like to speak about educating about substances, about alcohol, the effects. But the education and prevention, it goes further than just the knowledge. We try to implement life skills. We try to develop a sense of worth in our children. And we find that once they understand the different life skills, such as a healthy support system, how do you cope in challenging times? These type of topics also helps to prevent the first onset or how much you drink, because you want to take better care of yourself and to support your peers as well in taking better care of themselves, knowing your value. And so don't stop the conversation at just educating of the dangers, or don't stop the discussion at just saying drink responsible, but we have to take it a step further to help individuals really understand their worth and take value in themselves. Because I believe doing so will be more mindful of how these sugar-sweetened beverages, how alcohol affects our body and how it may impact us for years to come. When we love ourselves more, we take care of ourselves more. And so let's expand the discussion outside of education into how do I value myself more? How do I have worth? Also to parents and guardians, be mindful of the type of music your children are listening to. We got calls, maybe last year was the first time I heard of it, but there's a popular R&B or pop artist who promotes this drink called Lean, and I will use this platform to inform. So what the children are doing because of this popular pop artist, they take Sprite or ginger ale, they mix it with cough syrup, and often drop candy, normally Jolly Rancher, and that gives them some sort of high. So it's lean, it's known as lean. Do your research. After we started, we had to do our own investigation. We went out into the schools. We also heard it's called scissor. And there's a way you have to say scissor. But be mindful of what they're listening to, what they are viewing, and have the talk. Do not be afraid to have the conversations with your children. Show them that you care, and they then can share that information with other peers. So let's expand the discussion, be mindful of the music, the entertainment that they're listening to make a difference. So let's develop self-worth and good communication among parents, among peers. And that will be it.
So alcohol is in fact the single most potent dietary risk as it would relate to cancers. And just to say that in what would have been 2020, there were over 19 million new cases of cancers that were diagnosed. 1 out of every 4 deaths is as a result of cancer. And in terms of where it is that we are heading worldwide, just to say that the cases are expected to practically have doubled by what would be 2040, which really isn't that far off. And so then alcohol is something that we definitely need to address. My approach is perhaps a bit more different in the sense of not only would I like to see what is a decrease in the alcohol consumption, but possibly to what may be the complete elimination of the use of the alcohol. And I think that that is important because, again, when we highlight what the effects of the alcohol would be as it would pertain to ultimately what is one of the greatest emergencies within the world, which is cancer today, not only does the alcohol predispose you to cancer, but it also too increases what would be your risk for the absorption, rather, of other carcinogens. So even what may be, for example, the use of tobacco and so forth, just by simply using the alcohol, you actually increase the risk for the body to now be able to have an uptake, a greater uptake of these carcinogens. It also too increases your risk for other cancers simply by creating what is a state of immunosuppression, as we would say. So it weakens your health system on a whole. And not only that too, but it also too has what is going to be a decreased effect in terms of the chemotherapeutics. So in other words, even when it comes to treating your cancer that you may have already had, then this helps to delimit what would be the response to the treatment, as well as to, it also helps to the progression of cancers that may already exist, whether you are aware of it or whether you're unaware of the cancer being existent. And so if for nothing else, because so often I hear, what is it that we can do about these cancers? Why is it that we're having all of these cancers? Why is everybody getting cancer? And simply put, this is actually one of the best ways that we can actually do something. So yes, cancer is something that is preventable, and this is one of the best steps that we can actually do by limiting or perhaps even better eliminating the use of alcohol. And thank you.
I would like to take this opportunity to thank all of our panelists for their contribution this morning and this afternoon. I'm sure that the listening and viewing audience would have learned a lot and would have already started to think about different ways that they can create a healthier drinking culture, healthier habits in general, and even start to think about how their Christmas and festive and carnival celebrations can look a bit different with a reduced alcohol and sugar-sweetened beverage consumption. It has been my pleasure to be your moderator for this morning. Thank you for joining us, and do have a wonderful day.
The sentiments of Ms. Harris, just to say thank you so much to the panelists for an excellent, excellent discussion. I think this was a very timely discussion. I appreciate your expertise. I appreciate everything that you brought to the table today. I think there's a lot that we can learn from today. I think we have to have some really important conversations with all of society, and that includes industry, in order to address some of these issues. I'm going to put somebody on the spot today, Mr. Knight, from the SKELEC. Just to provide a bit of a youth perspective, I think you had a question maybe, or you wanted to make a little contribution. Is that okay? Can I put you on the spot? Okay, come on.
Good afternoon, everyone.
Good afternoon.
One of the things we taught in SKELEC is to always be ready. So Abby, thank you for volunteering me and putting me on the spot. But it was certainly a pleasure to listen to the conversation this morning and this afternoon, and just to take in the eye-opening facts that all the panelists would have presented and the breathtaking statistics that were presented. I too, like Superintendent Henry, learned today that alcohol can be carcinogenic. That's something that I was not aware of. And even as many of the panelists pointed out, within our younger generations, we are seeing more and more that drinking culture becoming more prevalent, with it being a rite of passage, with people drinking at younger ages. And even at many of the fetes that younger people are now attending, we are seeing high school age students going to these events, and they are expected also through society to drink as well. And I think what we need to see in this upcoming Christmas is an enforcement of perhaps showing your ID when you're purchasing drinks, so that that too could curb some of the increased drinking among those under the age of 18. But I also had a question as it related to COVID-19 and its impact on the drinking culture, because I know statistics have shown globally that domestic violence increased, and as a panelist pointed out, that alcohol is a cause, and it adds on to that effect of domestic violence within the homes. And so to any of the panelists, what effect have you seen, if any, that COVID has had on the drinking culture? And as we go forward in a post-COVID world, or living with COVID, how do you foresee us now juggling that increase in domestic violence, that increase perhaps, if there has been, if studies have shown an increase in alcohol consumption? And then the final question, what do you think can reasonably be done to curb that drinking within the younger age bracket? Thank you.
Thank you for those questions. I think from a law enforcement perspective, what COVID-19 has taught us is that persons would do anything to get their alcohol. We had periods of lockdowns where persons were required to stay at home. And most of the times when we found persons who were breaching the curfews, breaching the lockdowns, they were in somebody's backyard drinking alcohol. There were quite a number of illegal parties and gatherings that we encountered where persons were just there just for the purpose of drinking. So it seemed as though because they were not able to get it at home, or drinking it at home by themselves was not ideal, they gathered at one spot. They found an ideal spot and they gathered there to consume the alcohol. So we have a real bad alcohol problem in this country, that people will go to the lengths of breaking the law just to get their alcohol.
As it relates to what can be done to help curb, at the National Council on Drug Abuse Prevention, we are really making effort to ensure not only the education and prevention programs are in place at schools, but we also target other vulnerable populations. So from time to time, you touch on domestic violence, so from time to time, we will assist the Gender Affairs Department with discussions and education surrounding substance misuse and abuse. We also try to train as many frontline persons as possible. So we had a number of certified and non-certified training courses in drug prevention and drug treatment. So we've had nurses, medical doctors, guidance counselors, police officers, you name it, really trying to equip them on how to deal or how to respond to individuals who are faced with substance misuse or any form of substance use disorder criteria. So we are doing a lot of training. We are in the process of developing a number of manuals. We would have done quite an extensive amount of work at the high school level, but we realized there was still a gap. So recently we launched our primary school education and prevention program, because we believe it starts at an early age. There is also a parenting program that we are hoping to launch very soon as well, to help with parent-child relationships, to try and curb that situation of substance misuse and abuse. And we're looking at mentoring program as well. So these are just some of the areas: education, training and equipping individuals, parenting programs, mentorship programs, and we are really making a lot of effort to ensure that these things are in place to help address our alcohol culture in St. Kitts-Nevis.
So I think from the standpoint of medicine, to just answer your question in terms of whether we saw an increase during the pandemic, yes, certainly. But I think it's really just circling back to what the pandemic caused, which is that social isolation. And that social isolation then increases the level of stress. And then we have a natural sort of go-to response in periods of stress. We just have a drink. The challenge that It's interesting that he spoke about individuals who would perhaps try to break the curfew just to be, because most individuals think that alcoholism is if you're drinking a lot on your own. That's alcoholism. If you're drinking a lot with people, it's socialization. So individuals try to get other, because if I'm home and just like one drink after another, I'm an alcoholic. But if I do it with 2 or 3 friends, no, we're just socializing. It's just we're just having conversation, just 1 or 2 drinks here, and then you see the beer bottles pile up on the table and whatever and so on. So we saw that. I think what we have to look at as well is, and just circling back to why we're actually here talking about reimagining Carnival. Carnival is part of our culture, but how else is our culture throughout the rest of the year? What are some of the activities? Because I think what it is, the challenge for most people is finding that alternative to an activity where alcohol is just a central part of it, right? How else are we, the theater, the art, the dance, those are the things that actually keep our young people engaged, brings an audience, and alcohol is actually not necessary for that at all, because you have that expression of our art and our art form and our culture, which is not just Carnival alone. So we can start thinking of outside the box of those other activities where that very culture, which is so rich and so beautiful and so marketable. I look and I see some of the healthy beverages, but the cruise ship passenger, how often do we see these passengers, the minute they show up, the first thing they get is a rum punch? How about a healthy drink? Right? So those are some of the things I think that needs to be done. And from the standpoint of the Medical and Dental Association as well, we need to engage with these parties, with these individuals, because when I say to a diabetic, don't drink this, don't drink this, don't drink that, don't drink that, and so on, I am not providing any alternatives, and I actually did not know these brands exist. So the question is, how do we create, how accessible are making the product to those individuals? Because I struggle with that sometimes. I say, if I'm a diabetic and you're cutting out everything, what are you leaving me with? Because the stress that this causes, it makes you feel like you're sick. It makes you feel like you don't have a disease, the disease has you. And I like to live in the real world and recognize that you have all those choices to make, you have all those addictions to confront with, and you have the ubiquitous nature of all the unhealthy things that actually is contributing to your disease. Brands like this, Lake Health and Wellness, what you're doing, Abby, such great work and so on. And last week we had a fantastic meeting. I think there's great things on the horizon for tackling NCDs. In fact, I think St. Kitts is well poised to become the model for the Caribbean in actually fighting those things. So that's sort of, creating healthy activities. We want these healthy brands to sponsor sporting events. That's what we want to see at the sporting events. And we want to work with and that sort of partnership, I think, is going to do a great deal of work in terms of helping them.
Thank you so much. So I extended the panel discussion just a little bit just to give the youth perspective. But I want to say again, thank you so much to the panelists. Superintendent, thank you so much for your insight. It's very useful to get your insight, particularly around the crime and all the social issues that are going on and that are associated with alcohol. Thank you, Ms. Harris, for facilitating so beautifully this panel discussion. So thank you so much. Thank you, Dr. Pierre, for your insights as well. Thank you, Ms. Byron-Caines. Thank you, Dr. Tate, as well, for your contribution as well. We really appreciate it. And thank you, everybody in the room, and thank you to the listening audience as well. We hope you learned a lot, and enjoy the rest of your day. Thank you so much.